Sure. Okay, well, welcome to our Medicare seminar with the Mayo Employees Federal Credit Union. Welcome to those of you who are joining online, and for the one person in person today, I think the nice weather has kept a lot of people away. But my name is Dave Brown, and I am with TrueLink Medicare Advisors. We are owned by the Minnesota Credit Union Network, and the Minnesota Credit Union Network is the trade association for credit unions across Minnesota. The Credit Union Network is a not-for-profit, so any money we make from the TrueLink Medicare business, we put back into doing advocacy work for credit unions in Minnesota. During the presentation, if you have any questions, feel free to enter it into the chat online or just raise your hand. I'd be happy to answer your questions as we go along. I've been doing Medicare for 18 years now, so hopefully I'll be able to answer any questions you have. We are licensed in several states. Our home state obviously is Minnesota. We're licensed with all of the Medicare Advantage plans in Minnesota, many of the Medigap supplement plans and the Part D prescription drug plans. We're going to go over the differences of those in a little bit. Excuse me? Part B or D? Part D as in drugs, yeah. Yeah. So, yeah, so thank you for coming. Hi, welcome. We do have handouts and refreshments over here. Thanks. So the basics of Medicare. There are two parts of Medicare that you get through the government, and our agenda today is why would you want to use TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? The different enrollments and the deadlines. What are your costs associated with Medicare? What if you decide to work past the age of 65? We'll talk about how that works. And then private insurance options. If you have been a Mayo employee, if you started with the Mayo Clinic prior to January 1 of 2002, you may be required to use a company called Via Benefits. If you started prior to that date and you work for the Mayo Clinic in Rochester, your HR will let you know if you're qualified to go through Via Benefits. If you are, you're going to get some health reimbursement money once you retire and go through them. If you don't go through them, you're going to forfeit that money. So you want to go through them if you started prior to January 1 of 2002, but we can still help guide you and direct you and be here to advise if you want that. So information overload. Once you near the age of 65, you'll see that your mailbox starts filling up with postcards and letters from everybody who wants to sell you Medicare plans. In the fall, especially on TV, September, October, November, about all the ads you see on TV are Medicare ads. That's why the Mayo Employees Credit Union vetted us to be here of service to help you. If you want our help, there's never a cost associated with using us, but we're here to help advise and give you direction and planning for your Medicare. Like I said, there's never a cost for using us. We get paid by the insurance carriers if you choose to sign up for a plan through us. And with Medicare Advantage plans, we get paid the same commission no matter what insurance carrier you go with. With Medigap supplement plans, we typically are paid a percentage of whatever your annual premium is. So that's how we get paid. But we're also here to help educate you and guide you through your decisions. Like I said, we offer multiple companies and plan types. Medicare isn't a one-size-fits-all. If you have a spouse that's going to be on Medicare, they can choose one plan, you can choose a different plan. So we really, when we walk you through this, we'll ask you for a list of your prescriptions and what providers you see, and we try to help you find a plan that's going to work best for you. Oftentimes I get asked in these seminars for the Mayo, people will tell me, well, the Mayo Clinic in Rochester doesn't accept Medicare Advantage anymore. They do. They accept Medicare Advantage plans from Blue Cross of Minnesota and from Medica. So those are the two insurance carriers that the Mayo Clinic in Rochester still accepts for Medicare Advantage plans. The Mayo clinics in Florida and Arizona do not accept Medicare Advantage plans, but Rochester still does from those two insurance carriers.
So if you go there to visit or live part-time of the year in Florida or Arizona?
If you wanted to use the Mayo, if you're in the,
if your base is here?
yeah, if you wanted to use the Mayo Clinic in Florida or Arizona, you would want to go with a Medigap supplement plan as opposed to a Medicare Advantage plan. And then every year during the annual enrollment period, because what prescriptions the insurance carriers cover changes from one year to the next, we like to review that for our clients every year in the fall to make sure that whatever plan you have this year is still going to be the right option for you for next year. And if it's not, then we help look up your prescriptions and make sure we can find you a plan that is going to cover your prescriptions for the following year. Original Medicare Part A and B, you get these two through Social Security. You can apply for Medicare Parts A and B online at ssa.gov. That's the Social Security website. If you've ever created an account for yourself on Social Security, you can log into your account, and if you scroll down far enough, you'll find a link to sign up for Medicare. You can do this typically at age 65. If you're going to continue working, you do not have to sign up for Medicare Part A and B at age 65. You can delay it until you retire, or if you have a spouse who's still working, you can delay enrolling in Medicare if you're on your spouse's employer plan, as long as that employer has 20 or more employees. You can delay enrolling in Medicare. Most people will sign up for Medicare Part A at age 65 because you don't have a monthly premium to pay for Medicare Part A. Medicare Part A provides coverage for hospitalization, skilled nursing, home health care, and hospice. If you're contributing to a health savings account through your employer or your spouse's employer, if you're the owner of that health savings account, you do not want to sign up for Medicare Part A if you're going to continue working past the age of 65. If you sign up for Part A, you can no longer contribute to your HSA account. So if that's you working beyond the age of 65 and you contribute to an HSA, do not sign up for Medicare A or B.
You can't work at all?
Oh, you can work past the age of 65, but if you're,
Can't be a part of Part A?
you don't want to sign up for Part A. If you sign up for Medicare Part A, you can't contribute to your HSA account anymore, even if you're still working. Does that make sense? Okay, so let's say you're...
Like if I retire from Mayo, but what if I get a one-day-a-week job just doing something fun, like cake decorating or something?
so-
You can't be on Part A?
Oh, you can be on Part A as long as you're not contributing to a health savings account.
Okay.
Like if your employer offers you an account where you can contribute to a health savings account, an HSA,
Okay.
that's when you wouldn't want to sign up for Part A. Otherwise, it probably makes sense to sign up for Part A at age 65.
Yeah, that's if you take it. They offer it, but you have to take it.
Yes, yeah.
Not so much.
You would have to take it, yes. That's correct. And then Medicare Part B, there is a monthly premium for Medicare Part B. This year, that's $202.90 a month, and for most people. Medicare Part B is coverage for your doctors and specialists, ambulance, medical equipment, outpatient type things. And if you're going to continue working or your spouse continues to work and you're on that employer plan, then you do not need to sign up for Medicare Part B. You can delay that until you get ready to retire. And we'll talk about how the penalties work and how you can avoid penalties in just a little bit with that. So there are things Original Medicare doesn't cover. Original Medicare is not going to cover comprehensive dental. It's not going to cover eye appointments or hearing. It doesn't give you worldwide coverage, doesn't give you fitness benefits, or doesn't cover outpatient prescription drugs. Original Medicare also no longer covers an annual physical. So if you, people talk about the differences between Medigap supplement plans and Medicare Advantage plans, and we're going to go into that in a little bit. But if you sign up for a Medigap supplement plan, it will not pay for an annual physical because Medicare doesn't pay for an annual physical. If you go with a Medicare Advantage plan, most of those plans will still cover an annual physical. Do we have a question online?
Yeah, do you know, if Mayo Clinic elected to no longer accept Medicare Advantage from Blue Cross Blue Shield, Medica, if so, what decisions would need to be made recognizing that risk? That's the question we have online.
Yeah, so I mean, it's always possible that the Mayo Clinic Rochester could just stop accepting Medicare Advantage plans as a whole. I would assume that they're going to give people advance notice so that they can switch plans during the fall. But yeah, you would look at, yeah, that's where those are things you need to weigh. If you think that's a strong possibility for your future, when you're first eligible for Medicare, you probably want to go with a Medigap supplement plan then, if you want to use Mayo, if you think that's something that could be coming down the road. I think, does the Mayo use Medica for their employee insurance? Yeah. Yeah, I find it probably highly improbable that they would take Medica Advantage plans, but I don't know the future. I can't predict the future, but if that's a concern of yours, and those are things we would talk through if you choose to meet with us. My suggestion would be maybe you want to go with a Medigap supplement plan then. You're going to pay more for that, but it's going to give you the confidence that the Mayo is going to take those. Good question.
Can I ask a question?
Yes.
So how does that impact with that other one that you mentioned, if you're employed before 2002, the V benefits, how does that all?
Yeah, so if your employment started with the Mayo Clinic prior to January 1, 2002, at the time you retire, your Mayo HR is going to let you know that you can go through it's a third-party provider called VIA Benefits, and it's all going to be over the phone, but they can help you select a plan, and then they're going to offer you health reimbursement money. It's over $1,700 a year if you qualify that you would get to help you with your expenses.
And we could do that instead of doing these Blue Cross Medicare
Well,
plans?
VIA Benefits is going to offer the same plans that we offer. It's going to be the plans that are available in whatever county you live in.
And what did you call it, health reimbursement?
HRA, Health Reimbursement Account. Yes, question online.
Yes, this person asks, my husband is on my Mayo custom insurance with HSA. He is now enrolled in Medicare A and B via disability benefits. Should I keep him on my plan or on Medicare? Any risk in declining B now for him?
Yep, that's a good question. So because he's not the owner of the HSA account, he can stay on A and B if he wants to. However, if you're going to keep him, if it makes sense financially to keep him on your Mayo plan, I don't know what the cost is for you to have him versus you having it alone. You can contact Social Security to suspend his Part B. As long as your spouse is going to stay on your employer plan, you don't need to be paying that $203 a month for Part B. When you get signed up for Medicare early because of Social Security disability, you're automatically enrolled in A and B, but you can decline the Part B if you're going to stay on the employer plan. Yes.
In Minnesota, can you switch from Advantage back to traditional Medicare without underwriting?
Well, Minnesota has a new law going into effect this year where up until age 70, if you start with Medicare Advantage plan, you can switch to a Medicare supplement or Medigap plan up until age 70 without the health underwriting. However, you are going to pay a premium if you do that and move from an Advantage to a supplement plan. You'll pay an additional amount because of that. But in Minnesota, starting this fall, you will be able to do that as long as the state legislature doesn't change that. If you start out with Medigap supplement plan and you want to go to Medicare Advantage, you can sign up for Medicare Advantage for 1 year. And if you don't like it after that year, you can go back to the same Medigap supplement plan that you had without any health questions being asked. Sorry, I've got some allergies I'm dealing with. Good questions. So private health insurance options. There are what we've been talking about, supplement or Medigap supplement plans. Medicare Advantage plans, also called Medicare Part C. And then there are standalone Medicare Part D prescription drug plans. We'll go over these. With Medigap plans, in most of the country, these types of plans have a letter associated with them, like Plan F or Plan G or Plan N. In Minnesota, we don't name them that way. We name them a little differently. In Minnesota, they're called basic plans or extended basic. Some insurance carriers have a copay plan, and some insurance carriers have a high deductible plan. The benefits with the Medigap supplement plan never change, and that's assuming Congress doesn't change them. But traditionally, Medigap supplement plans, the benefits do not change. The premiums tend to go up every year, but the benefits don't change from year to year. With most Medigap plans, you can see any doctor in the country that accepts Medicare. It travels with you when you leave the state or the country, and if you move to another state, you're not going to lose your Medigap supplement plan. That may not be as positive as it sounds. Minnesota has some of the highest priced Medigap plans in the country. Even states, Iowa, Wisconsin, Arizona, Florida, a lot of these states, their Medigap plans are half the price of what they are in Minnesota. So if you were to move to another state, you may want to be able to switch to one of their Medigap plans because it would most likely save you money. But if you have a Medigap plan in Minnesota and you move to another state, if you want to pick up a Medigap plan in their state, you will go through underwriting or health questions. And if you answer yes to any of the health questions, you'll keep the Medigap plan that you have from Minnesota.
What about South Dakota?
South Dakota, their rates are a lot cheaper too. Yeah. With Medigap plans, again, that's just your medical coverage. Medigap plans don't give you coverage for prescription drugs. They don't give you coverage for vision or dental like Advantage plans do, and they won't pay for an annual physical with the original Medigap plans. With Medigap Advantage, or excuse me, with Medicare Advantage plans or Part C plans, all of your benefits are rolled together for one monthly premium. So with Medicare Advantage plans, you're going to get your medical, your prescription drugs, dental, vision, hearing. Many of them have free gym memberships. They provide maximum out-of-pocket protection, a cap on your money. They do have networks. So there are two different types of Medicare Advantage plans in Minnesota. There are HMO plans and there are PPO plans. If you go with a PPO plan, you're going to have national networks to where if you're traveling across the country, you're going to have a network of providers you're going to be able to see all across the country. If you go with an HMO plan, you're going to be very limited on who you can see if you're traveling. Usually it's the emergency room at a hospital that accepts Medicare, and that's going to be about it. So PPO plans with Advantage give you a lot more options than HMO plans do. You do need to see a provider that's in network. Minnesota is kind of an outlier with Advantage plans in that we have insurance carriers where 97% of providers are in their network. That's not typical for most states, but Minnesota, I'd like to say, has the best Advantage plans in the country in terms of the size of the networks and the benefits that are offered. If you were to, you don't need to see a referral to see a specialist if you're on a PPO plan. You would if you're on an HMO plan. If you move to another state or sometimes even to another county, you may have to switch your Advantage plan. If you lose a Medicare Advantage plan against your will, like moving to another state or moving to another county where you lose it, that gives you the option if you decide you want to go with a Medigap plan. You can do that if you lose your plan against your will because you moved. You can get into a Medigap plan without being asked any health questions. And you can enroll during valid enrollment periods. The benefits with Advantage plans can change from year to year, and the premiums can change from year to year. Any questions on that? Okay. And then if you do go with a Medigap supplement plan, if you want prescription drug coverage, you would want to sign up for a Part D prescription drug plan. Every company has a formulary, which is a list of medications that they cover or don't cover, and that's what we help look up for you. You want to make sure whatever plan you choose, that plan is going to cover any prescriptions that you're taking. They all have different tiers of coverage. So tiers 1 and 2 would be generic medications, typically. Tiers 3 and 4 would generally be brand name medications. Tier 5 would be if you're on any specialty medications. And then some companies offer a Tier 6, which are the lowest cost generic options out there. You do not have to sign up for prescription drug coverage if you don't want to. If you go with an Advantage plan, you're typically going to get that included. If you go with Medigap, you don't have to sign up for prescription drug coverage. I've been doing this for 18 years, and I've had people over the years say, I don't take any medications and I'm never going to. For some people, that's been true. For others, they come back several years later and say, my doctor put me on a prescription, I want to sign up for a plan. At that point, the penalty tends to be so large that you might be better off just paying the full cost of your medications. But if you delay enrolling in Medicare prescription drug coverage when you're first eligible and you wait until down the road when you need it, you are going to pay a penalty on top of your monthly premium, and that'll be every month for the rest of your life. There are low-cost prescription drug plans out there that start around $5 a month. So if you want to avoid that penalty, if you're not taking any prescriptions, you can sign up for something like that, or you can go with an Advantage plan that includes it. Any questions on that? Okay. Something new that the government started last year is they put a cap on prescription drug costs for individuals. In the past, you may have heard of something called the coverage gap or the donut hole. That's once you and the insurance company paid X amount of dollars for your medications, you fell into this donut hole where you were paying pretty big costs for your medications. The government has done away with that, and this year they've put a cap on medications of $2,100. No. So chemo would be considered Part B medication. Any infusions or injections you get at the clinic fall under your medical plan. Any prescriptions you pick up at the pharmacy would be under your Part D prescription drug plan. If you're going through chemo and you're on, oh, if you're picking it up at the pharmacy, then it would be yes.
And it is chemo, but it's.
Yes, yeah. So if it's not an infusion, if it's oral that you pick up the pharmacy, then yes, your Part D plan would cover that. Well, it should. The Part D plans are required to cover every category of medication. Some cover more brand names than the others, and that's why we look them up for you to make sure that you have the coverage. But the cap is $2,100. If you hit that cap before the end of the year, then the insurance companies are now required to pay 100% of the cost of your medications. Every year, your insurance company will send you forms. You are not required to sign up for this Medicare prescription payment program. There's no cost to it. But if you sign up for the Medicare prescription payment program because you have high prescription drug costs, when you go to the pharmacy, you won't pay anything for your medications at the pharmacy. You'll be billed by your insurance carrier every month for your prescriptions. And I work with people who they hit this cap by February, and when you're retired, if paying out $2,100 in a month or two can be prohibitive for some people. So you do have this option of this prescription payment program, and instead of getting hit in the first couple of months, the insurance carriers spread those costs out over 12 months for you. So it's an option for people now. You're not required to join it, but if it's something that can be of help to you, it's out there for you now. Any questions on that? Okay, yes.
Is there an out-of-pocket max for Part B?
There's an out-of-pocket maximum with Advantage plans. So that's different than a deductible. The Advantage plans in Minnesota, almost all of them don't have a medical deductible, but they do have a maximum out-of-pocket protection. And going through like chemotherapy infusions, that's about the only way, or some type of an infusion or injection, if you're getting those regularly, that's about the one way you would hit your maximum out-of-pocket. But if you do hit maximum out-of-pocket, then you no longer have co-pays the rest of the year for your medical. With Medigap supplement plans, you may or may not have a maximum out-of-pocket. I hope that answered it for you. The different enrollment periods. Your initial enrollment period is called the initial coverage enrollment period. It's a 7-month window, based around the month you turn 65. It starts 3 months before the month you turn 65, the month of, and 3 months following. So if you're going to enroll in Medicare at age 65, this is a 7-month window in which you have to do it. If you're going to continue working, or your spouse is going to continue working past the age of 65, you don't have to enroll at age 65. But if you're retiring and you want to go on to Medicare, like I said, you have this 7-month window. Your Medicare would start the first day of the month you turn 65. So if you start the process 3 months prior, you make sure you're signed up for Medicare. If you're going to be collecting Social Security benefits at age 65, you will automatically receive your Medicare card in the mail about 3 months prior to when your Medicare would start. If you're not going to be collecting Social Security benefits but want to start Medicare at age 65, then you contact Social Security and sign up for Medicare Parts A and B. That's something we can help you with too. But you can start it 3 months before the month you turn 65. It goes into effect the first day of the month you turn 65. If you're working or your spouse is working and you're going to delay enrolling in Medicare, especially Medicare Part B, once you are ready to retire, then you fall into the special election period. You would want to start applying for Medicare Part A if you haven't done that already, or Medicare Part B 3 months, 2 to 3 months before you're going to retire. It's going to take Social Security about a month to get your new Medicare card to you. And again, you can do that online. You can go to the Social Security office, or we can help you with that. Excuse me. But you want to start it soon enough to where it's going to be seamless from the time you retire and leave your employer plan to when you go on to Medicare. And again, we can be here to advise you with that, help you with that. And then every year, once you are on Medicare, there's called the annual election period, and it's October 15th through December 7th. Every year it's October 15th through December 7th, and this is the time frame in which, if you're on a Medicare Advantage plan, you can compare options to other Medicare Advantage plans for the next year, or if you're on a standalone prescription drug plan, you can review your options for what's going to work for you for the following year. The majority of people don't review their options every year. It's a good idea to review your options, especially for your prescriptions, because just because your insurance carrier covered a prescription like Eliquis or Ozempic, something like that this year, doesn't mean they're going to cover it the next year. So you want to make sure you know every year going into January that your prescriptions are covered, and that's something that we help our clients with every year. And then the other enrollment period is if you have a Medicare Advantage plan, you still have one more option from January 1 through March 31st every year. If you're not happy with the Medicare Advantage plan you have going into January, you have one more enrollment period in which you can switch to a different Medicare Advantage plan. And if you make that switch from January through the end of March, it's going to go into effect the first day of the next month that your application is submitted. You can also totally leave a Medicare Advantage plan during this time and just go back to original Medicare. Any questions on that? Okay. So delaying Medicare benefits. We've talked a little bit about working past the age of 65. We can help you compare your costs and benefits of Medicare to your employer insurance. If you're on the Mayo insurance plan, my experience has been you're better off staying on the Mayo plan than going on to Medicare if you're going to continue to work past the age of 65. Mayo's insurance is deemed creditable by Medicare. That's a good thing. Again, if you're plan from your employer, if you're contributing to a health savings account and you're going to continue working, do not sign up for Medicare Part A, or you will no longer be able to make those contributions. When you are ready to retire, you're going to want to stop contributing to your HSA account. The rule is you should stop 6 months before when you're going to go on to Medicare Part A or Part B. My advice to people is when your notice from your employer comes out typically in November about the new plan options for the following year, if you have a pretty good idea that you're going to retire that following year, stop contributing to your HSA January of that year, and you'll be close to hitting that 6-month mark typically. If you forget about it and don't stop contributing, you're going to get taxed on your contributions to your HSA. It's not a huge deal, but the whole idea of contributing to an HSA is to not be taxed on it. So you would get taxed if you forget to do that. 2 to 3 months before you're ready to retire, you can apply for Medicare Part A and Part B online. Or if you've created an account for yourself on Social Security's website, if you log into that, you can scroll down to the link to apply for Medicare. We can help you with that also if you need help, or you can go to your local Social Security office to do that. There is a form your employer would need to provide for you if you've delayed enrolling in Medicare beyond the age of 65, and the form looks like this. It's called a request for employment information. You fill out Section A, the employer fills out Section B, and what they're doing is they're just verifying that you had employer coverage beyond the age of 65. And then when you apply for Medicare Part B, this form gets submitted at the same time you apply for Medicare Part B, and this is what prevents any penalties for not having signed up for Part B at age 65.
Does that have a number on what the form number is?
The form number, it does, if I can read it. It's form CMS, as in Centers for Medicare Services, CMS-L564. It's something I can email to you. I know the Mayo HR deals with it all the time. Or you can go to Medicare.gov and enter Part B forms in the search tool, and it'll bring it up there too. But yeah, if you delay Medicare Part B beyond age 65, you need to submit this in order to avoid that penalty for not signing up at age 65. There are income impacts once you go on to Medicare. There is help for, it's called extra help, if your income drops below a certain level and it's going to be hard for you to pay for your Medicare costs, or maybe it's not you, maybe you have a relative or a friend who you know is struggling with their Medicare. There's something called extra help that's available. The percentages across the top are the percentages of the federal poverty guidelines, and based on your family size, if your income falls below these different levels, you are most likely going to qualify for some sort of extra help. When you qualify for extra help, it can lower or eliminate your Part B premium, that $203 a month that you pay. Depending on the level you qualify for, you wouldn't have to pay your Part B premium, and it's also going to help with the cost of your prescription medications. So whether it's you or someone you know, I run into people all the time who've been on Medicare for several years. They had no idea this was available to them, and they're just really struggling to make ends meet. It's worth submitting if you or someone you know falls into that category. The other side of the coin is if you're high income, there's something called the Income Related Monthly Adjustment Amount, or the IRMA. Every year, Social Security works with the IRS to look at your tax returns from 2 years ago, your federal returns. And if your modified adjusted gross from 2 years ago is over whatever the threshold is for the year, then they're going to add on a surcharge to your Part B premium and the Part D of your whatever prescription drug plan you have. This year, if you file your taxes as an individual, if your modified adjusted gross income from 2 years ago was over $109,000 a year, then Social Security is going to notify you that they're going to add on a surcharge to your Part B premium and your Part D premium. If you're married filing jointly, if your modified adjusted gross from 2 years ago was over $218,000 a year, Social Security is going to add on that surcharge. So you can see on the third column under the Part B monthly premium how much your income can go up based on what your modified adjusted gross was for 2 years ago. So if you're in the really high income category of $750,000 a year or more, your $202.90 premium is going to jump to $689.90 a month. And your Part D premium is going to jump up by $91 a month. There are exceptions when If you fall into this category, you'll receive a letter from Social Security letting you know, and they also have a process for appealing it. So sometimes people, maybe you sold a house 2 years ago, or you had an inheritance where it was a one-time thing. Oftentimes, Social Security will grant an appeal to that. If it's just based on regular income, typically they won't. But there is a process if they tell you that they're adding on a surcharge based on your income tax returns from 2 years ago. There is a process to appeal it, and that's included in the letter that Social Security sends. Any questions on that? It's not a lifetime surcharge. They take a look at your income every year then thereafter, and if your income ever drops below whatever the threshold is for the year, then you no longer have to pay the surcharge. Okay? So premium costs with Medicare and private health insurance options. We know that for Medicare Part A, if you've worked in the United States for at least 10 years, you've had the Medicare tax come out of your paycheck. There is no monthly premium for Medicare Part A. Medicare Part B this year, the standard premium is $202.90 a month. If you go with a Medicare Advantage plan, in most states in the country, including Minnesota, there are plans that start at $0 a month and can go up to over $100 a month or more. If you go with a Medigap plan, you still pay the same amounts for Medicare Part A and B, but with Medigap plans, if you go with a high deductible plan, you can get one for about $7,500, but you're going to be paying about $3,000, the first $3,000 in expenses. If you go with a Medigap plan that would be comparable to a Plan G, you wouldn't, where you pay a $283 deductible and then you would have no copays after that. Those plans in Minnesota are going to run about $330 a month. With Medigap plans, again, you wouldn't get prescription drug coverage and you wouldn't get dental and vision. So if you go the route of the Medigap, if you want prescription drug coverage and dental coverage and vision coverage, you have to buy policies and add those on. So the Medigap side can be more expensive for your monthly premiums, but there are reasons why people want to go that route as opposed to Medicare Advantage plans. If you choose to meet with us and we sit down and talk with you, it doesn't matter to me which plan which side of the aisle you go with. It's whatever you're comfortable with and whatever works best for you. And we help talk that through with you. Sorry for you, those online, that probably doesn't sound very pleasant. So with that, you would received a handout when you came in, and we do have some over on the counter over there, but there is a white card in here. If you want to meet with us or need help with this, if you fill out this card, if you include your email address, I'm just going to send you a thank you for attending today and just say, if you need our help, please reach out when that time comes. You're not required to fill it out, but we do have you in our system then to help you if you need help. But if you fill that out and leave it with me, like I said, I'll send you a thank you and email for attending today, and then if you need help, we'll schedule a time to meet. For those of you online this afternoon, you'll be receiving information. I do have a slide here. This is my contact information. It's my phone number, my email address, and the email address for our agency in general. If you need help or guidance, feel free to reach out and we can schedule a time. If you're here in Rochester or in Minnesota, we can schedule a face-to-face meeting. We can do a phone appointment. We can do a virtual appointment. If you're in another state, maybe you're with the clinic in Arizona or Florida, we'd be happy to do a virtual appointment or a phone appointment, whatever you need for help with this. But we're here to...
Rochester?
What?
You're not in Minnesota?
Oh, we are, yes.
You are.
Yeah. Yeah, we're in Minnesota. So with that, does anybody have any questions over? Maybe you came in with some questions that didn't get answered, or those of you online, maybe there's a question you're hoping to have answered that wasn't. Please let me know.
What is the Silver Sneakers program? Is that not around anymore?
It is. So some of the insurance carriers offer Silver Sneakers, which gives you the free gym membership of any club that's in that Silver Sneakers network. Blue Cross announced last year that Blue Cross has silver sneakers, but they took Lifetime and the YMCA's out of their network because it was a little cheaper for them. Other insurance carriers use silver sneakers. Other insurance carriers have other networks of clubs that are in their networks. But if you go a Medicare Advantage plan, almost all of those offer a free gym membership. If you go with a Medigap plan, some of the insurance carriers offer a free gym membership, some don't.
And then what do people do for dental and vision?
So if you go with Medigap and you want dental and vision, if you can keep it through your employer once you retire, that's what some people do. We are getting licensed to offer dental plans. There's not a lot of great dental plans out there, and what we're finding is more and more dentists are opting not to be in network. Not that they won't accept your insurance if you have a dental plan, but if a dentist is in network, then they are agreeing to accept what the insurance company pays them as full payment. If they're not in network and they're willing to bill your insurance carrier, they can bill you the difference between what the insurance company paid them and what they would have normally charged. So more and more dentists are going that route because it helps with expenses, I'm assuming. But yeah, there aren't a lot of great dental plans out there. They're limited in what your cap in expenses. Like with Medicare Advantage plans, a lot of the plans, well, for Blue Cross, you're going to be capped at like $2,000, but it's all included. If you get a standalone plan, it's whatever your monthly premium is. And then there are different vision plans available too.
So Medicare, it's for people over 65.
Mhm.
Each have our individual plan.
Yeah.
But it also must cover other individuals that qualify for it, right?
Yes, so Medicare is for people 65 or older, but if you go on to Social Security disability, once you're on disability for 24 months, then you are automatically enrolled in Medicare Part A and B. If you have a spouse who's still working, who's not on disability, and you're on their employer plan, you can suspend your Medicare Part B if you want to, so you're not paying that $203 a month. And then you can get it going again once you either leave that employer plan or your spouse retires.
How does all the fraud that was going on in Minnesota fit into the picture? Like, how are those people getting Medicare options, do you know?
Well, there's different for immigration statuses and all of that. Some of that was medical assistance, not Medicare. But there's a huge amount of fraud going on in Medicare. One of the reasons in the past that people would go with a Medigap plan over a Medicare Advantage plan is Medigap plans, they didn't do pre-authorizations. If your doctor ordered that something requested for a service to be done, the plan paid for it. Well, in an effort to cut down on fraud, this year the federal government started a pilot program in 10 states, Minnesota is not one of them, but where the insurance carriers, if you have a Medigap supplement plan, they can now require pre-authorization before they'll pay for it. It's probably going to get rolled out nationwide in the next few years, but if it's successful. But that was one of the differences up until now with Medigap over Advantage plans.
So that in the news, it was a lot after that CEO from Medicare.
Yes, Brian Thompson.
Yeah, and it was a lot of, it brought to the surface a lot of like pre-authorization and denial and stuff like that. So do we have to go through pre-authorization if we have Part B?
So yeah, if you have an insurance carrier, if you have an Advantage plan, right now in Minnesota Medigap plans, you don't have to deal with pre-authorization, but it's coming. The nonprofit plans like Blue Cross and Medica in Minnesota and Health Partners, they have a much better record of approving pre-authorizations over the for-profit companies like United Healthcare and Humana. So, and United Healthcare doesn't offer plans in this county anymore. It's basically Medica and Blue Cross, but they have a much better record of approving pre-authorizations than the for-profit companies do.
So is that something we should probably consider when we're signing up pre-authorization and stuff like that?
That's something we will talk through if that's a concern of yours, yes. Yeah. Yes, online.
Regarding a consultation, are you familiar with all of the Mayo insurance plans, or should we come prepared with that info?
I've taken a look at several of the Mayo employees insurance programs, but it's always helpful if you bring that information with you so that we can compare and, apples to apples. And those plans can change a little bit from year to year too. Yes.
I will be transitioning off the Mayo plan and onto Medicare mid-year. Do you know if my deductible will start over again if I join Medica Advantage plan?
Yes, your deductible will start over if your plan switches, even if it's with the same insurance carrier.
Did you say in an earlier slide, Medicare covers ambulance?
Medicare does cover ambulance, yes.
So I went to some talk with MASA,
Yeah.
MASA, that's saying Medicare does not cover ambulance if it's not for, I can't remember the definition, was it an emergent situation? And he specifically used the example of, he went to the emergency room via ambulance. He wanted to drive. His wife said, no, you're having a heart attack based on your symptoms, which is actually quite true. But when he got there and they did the whole shebang, went via ambulance 2.8 miles or 2.4 miles from his house. And he got the bill later, and he was responsible because it came back as indigestion, which it's a fact. Indigestion and heart attack,
Yeah.
same darn symptoms. You'd be sweating like a whatever, and pain and heartburn and all that stuff.
Yeah.
Same darn symptoms, and because it was indigestion, even though he and his wife swore that's what was going on because it was so severe, they did not cover it, and it was a huge bill.
I've been doing this for 18 years. I've never had a client who has encountered Medicare not paying their ambulance bill. It's a very good sales point to make. I get mailings from MASA all the time. I'm not saying that it couldn't happen to you, but it sure helps sell their plans when you hear that. I'm not saying they're trying to be deceptive. It could happen. I've not encountered it in 18 years of having a client who it's happened to, but it's possible.
I'm a nurse.
Okay.
For 30 plus years, and I had that exact same thing happen, and my heart was flipping in my chest, and I thought, oh my God, it feels like it's gonna come out my throat. And I was gonna be darned if I was gonna take an ambulance from Methodist Hospital, where I work, over to St. Mary's, 1 mile down the road. So I drove,
Yeah.
and doggone it, it was heartburn. But they did the whole shebang workup, negative, negative, negative. Then they had me drink this, 30 cc's of a liquid globule. It was lidocaine. Symptoms gone.
Okay.
You have heartburn. I'm like, shut up. I don't even have heartburn. I wasn't having reflux. I wasn't having pain in my chest.
Yeah.
I was having flipping of the heart and this just weird sensation. And so then I'm at this MASA presentation. I'm like, are you kidding me? If I would have taken an ambulance, they would have charged me. I mean, maybe not with Mayo insurance.
Yeah.
But as a
And again, it's going to
private sector. And then the other thing he said is, if you're ever, like, say, in a car accident, and you say, I'm fine, I can, maybe your car can't drive, but I can get to the hospital. If the police or somebody decides to call an air ambulance, you're on the hook for it whether you refuse it or not. And it can be like $64,000. So I don't know. I mean,
Well, that's,
is
if you're in a,
it
yeah.
tactic, and Medicare really doesn't cover an ambulance?
I think it's a little of both. Some of it's scare tactics and some of it could be true. I'm not going to disparage them. If you're in a car accident, typically your auto policy is going to cover you up to $300,000 or whatever your limits are, and then your medical insurance would kick in. But that's choosing a nonprofit insurance carrier like Blue Cross or Medica they are less likely to not to do something like that, saying, oh, it wasn't a heart attack, so we're not going to pay. More likely, the for-profits like Humana and United Healthcare, they're more likely to do that. I mean, if you saw in the news, at least here in Minnesota, United Healthcare reported record profits again. They were losing money for a while, and they have to make money too, but you make those profits by denying claims. And when you work with a not-for-profit or a non-profit insurance carrier, you're going to see less of that than when you work with a for-profit.
I'm not familiar, is this Mesa, is that another company that offers?
They don't offer Medicare plans, but they offer these ancillary. Yeah.
Specifically.
Oh, ambulance
Specifically.
insurance.
I had a client who was telling me about it, and he said it was about $5,000 or something. I don't know what the price is, but
Yeah, it was something like that
Yeah.
for a lifetime.
yeah, it's entirely a decision you would have to make. I haven't run into where it would ever pay off, but it could.
Yeah, I mean, it was nice to get the information. I thought, okay, I'll look it over. But I thought, seriously, I am a nurse. And I had that same situation happen to me, and I thought, holy criminy.
Yeah.
This could be a heart attack. And what do women do? They totally ignore the symptoms. It's like, do I want to be dumb and ignore the symptoms?
Yeah.
Because this isn't normal.
Yeah.
And it was going on for a few hours that morning, and I finally headed over there.
I
Of course, they didn't even know, right?
Right.
Why would they do an EKG? Why would they do all troponins? Why would they do all this workup if they thought, nobody
Yeah,
knows
right.
until you get the results back?
It's going to be more likely that the for-profit insurance carriers would be the ones, if they were to deny it, it's going to be them. It's not going to be the not-for-profits. I can't say that as, as a whole, but yeah. Humana has, I don't know if Humana even still has plans available in this county. They've had a terrible reputation in Minnesota. I would say steer clear of, their prescription drug plans are good, but if you're looking at a Medicare Advantage plan, I wouldn't go with Humana. In other states, they might have better reputations, but they let go of all their staff in Minnesota because their plans, their enrollment drops so badly.
So you cannot be on Medicare till the day of your birthday of 65, is that right?
No, it would start the first day of the month you turn 65.
Of my birthday.
Yeah, unless you're on Social Security disability.
And so I'm still at Mayo. I'll be 65 in December.
Mhm.
But say I retire in 2 months, but I'm not 65 in 2 months. That would be, what is it, April now, June? Say I retire July 1st,
Yeah,
but I'm not eligible for Medicare till December.
right.
What do you do in that time? Can you go without insurance?
Well, typically you would either go with COBRA from your employer until that time,
Okay.
or you can go without. I wouldn't advise going without insurance.
Cobra.
Yeah.
I had
I
Cobra.
don't know, I'm pretty cheap, it's not,
I had Cobra, it's
I'm not on
expensive,
anything.
but-
Yeah.
I'm pretty boring.
Or there are some ministry health insurance cooperatives that would give you coverage too for a lot less money. But
Yeah, can you wait till you retire in like October?
In December, you mean?
Well, Cobra is only for so long, like 3 months?
18 months.
18 months, oh yeah, 18 months. And it wasn't so break the bank, but I get Mayo insurance right now, because I won't turn 65 till next year. And I could have bought a car with how much the premiums have gone up since I retired too.
Yeah.
Friends of mine or coworkers that have retired from Mayo said it's $1,000 a month, and somebody
Yeah.
just retired, and she said, oh no, it's $1,500 a month.
If they have less than 30 years of service, it's that much
Oh.
for individual. If you get supplement, if you have over 30 years, it's dollars.
They don't even go to their doctor.
I haven't been to a doctor since I retired 3 years ago. So an annual physical, that's a joke. You'd never get an annual physical at Mayo. Would you? Have you ever had an annual physical?
I know,
No.
I'm not on anything, I don't,
Okay.
Yeah.
I don't want
Yeah.
to prove it.
Yeah.
Well, yeah, if you fill out your that white card, give it to me before you leave, and I'll send you a thank you email. Online, you'll receive information this afternoon. If we can be of help, again, there's never a cost for our services. Please reach out and let us know, but thank you for being a part of our seminar today.